This time of year, as things are heating up with the UCAT, a lot of people are starting to get worried about their performance. So here I'm going to do a quick video as to what to do if you don't get the UCAT score that you were hoping for. Hi and welcome back to the channel. My name's Dr. Ashley Hilton. I'm a doctor and a dentist, and this is the channel that helps make your application to medical school bulletproof. So here we're going to talk about low UCAT scores and what to do if you find yourself in this situation. Of course, our primary aim is to prepare properly for the UCAT and ensure that we get a good score. And I'll show you at the end of the video how you can do that. But here we're going to talk about what you can do if you find yourself in the situation where the UCAT score wasn't what you were hoping for and what to do with regards to applying to medical school. So before we dive in, I just want to say one thing, which is when you're sitting the UCAT exam, it's always helpful to start early and try and sit the exam early in the application cycle, unless you have something that obviously hinders you from doing that. Because what's important about the UCAT score is your decile. Now, you can't know for sure, but immediately after sitting the UCAT, you will get your raw score. And based on previous year's data, you can usually tell roughly what decile or roughly whereabouts you'll get in and whether that is a good score or not. Now, this is really important to know this early on in the application cycle because it's going to give you a vantage point and help you make strategic decisions about how you apply tactically based on that score. It's going to tell you if it's a good score, whether you can aim for the more competitive medical schools, and if it's a not so good score, we're going to talk about options that we can go through now. So firstly, let's define what is a low score. If you have a look in one of the blog articles that I've recently posted, and I'll link to in the description below, you can see from previous data what kind of equates to the average score and what would usually get you into what decile. So for example, last year in 2020, the average score for the sections was 627.5, which is actually an unusually high year. Usually it ends up around the 620 mark. So last year was particularly high, and that was probably because last year a lot of people were stuck indoors with the pandemic and had no other things to do than just focus on the UCAT. And for the situational judgment, most people achieve a band 2 or higher, so anything below that, so band 3 or 4, is considered below average. So if you found that your UCAT score is below average, you still have a few options, and there are really 5 things that you can do. The first thing, I always say gather more information, so you can speak to the universities that you're considering applying to, tell them your score, and ask them to just give you a rough idea whether they think it's something that has done well in the past and has a chance of getting in, or given that you have maybe a lower UCAT score, whether it's worth using one of your application spots on them. The second is to consider applying to one of the newer universities, which generally tend to be a bit less competitive. Or the third option is to apply to the universities which are known to accept lower UCAT scores, which we'll come on to talk about in a moment. The fourth option is to consider taking the BMAT instead. Now, this is a lot more knowledge-based, so a lot of people don't suit the UCAT. So even if you've not performed well in the UCAT, you shouldn't be discouraged. There's every chance with the BMAT, which is a completely different style of exam, that you could score highly enough and get into one of the universities that accept the BMAT. So just to give you a list of the universities that take BMAT, those are Cambridge, Oxford, Imperial College London, UCL, Leeds, Brighton and Sussex, Kiel and Lancaster. And now you can see why sitting the UCAT early and having this information early on is going to give you a lot of time, it's going to give you a vantage point so that you can take a step back and work out how to proceed. And if you need to sit the BMAT, at least it gives you enough time to prepare for that. So the fifth and final option is to maybe take a gap year. If you have a specific university in mind and you know that your UCAT score won't make the grade for that, then you can take a year to maybe work in hospital, do something that's going to contribute to your application and to your eligibility to get in, and therefore just have another go next year. And at the end, I'm going to show you a proven way to improve your UCAT score if that didn't go to plan. So let's now go through some of the medical schools that historically are known to accept lower UCAT scores. The first one is Kenton Medway Medical School, which is a brand spanking new university opened in 2020, and their UCAT cutoff score was 604, so over 23 points below the average. Also, they would cut people off if they got a band 4 in the SJT, and they have quite a well-detailed process of how they select people. So if you want to check out that blog article that I was talking about, you can look in the description to see more details about that and all the other universities that I'm about to talk about. Next on the list is the University of Lincoln. Now, they also cut people off who got a band 4 at SJT, but otherwise their scoring system for the rest of the sections is on a points basis. Now, those points are combined with the other points from the rest of your application, and based on that total, they can decide whether to invite you to interview. And again, that article has more details about that point system. The University of Sunderland, who work in partnership with Kiel University, will accept anybody who scored bands 1 to 3 in the SJT and came in the top 8 deciles for the rest of the sections. But what if you did get a band 4 in the SJT SJT? Well, the University of Plymouth are probably the only university that do accept people who scored an SJT band of 4. And in 2020 for Plymouth, the cutoff for the other sections was 597.5, which is actually pretty reasonable. Cardiff University state that they may use the UCAT score as part of the selection process. But when I spoke to them directly, they said that essentially what they do is when they have two students that they're considering and they're not sure how to decide between the two, they'll use both students' UCAT score to compare the two and then offer the place to the highest scorer. Keele University state that they won't consider anyone below 570 average or an SJT band of 4. Queen's University Belfast and Hull and York Medical School have a point system to grade how they evaluate the UCAT score. And then finally, the University of Liverpool say that they weight the UCAT about 25% and then 75% towards your academic achievements. So that's a list and a brief summary of all the universities you could consider if your UCAT score didn't go to plan. The blog article goes into a lot more depth as to the kind of intricacies of each university and which one's probably better for you to apply to. But the best way to avoid getting into this whole situation in the first place is probably to just check out my UCAT course where I do 16 hours of videos. We basically go through absolutely every type of question that comes up, and then we have questions and work through explanations of the answers and why they are the way they are. People who've done my UCAT course say that they absolutely love the way it's delivered and have felt a massive confidence boost from going through the material. So I'll link to that in the description below, but if you want more free stuff, you can check out one of my UCAT playlists, which is just here now. So thanks for watching. I hope that's cleared up some of the UCAT stuff. If you want more details, like I say, you can go and visit that blog article, but otherwise I will see you in one of the next videos, whether it's on the course or more YouTube videos. Take care.